get to them. So in any case, let's see. So today, what we're going to be discussing is what is long-term care, what are options for managing the need, and what are the key decisions that you need to make regarding this very important topic. I thought it was important to discussion with just definition. You know, we hear a lot about long-term care, but it's important for us to just really, define the basics. So long-term care is the assistance with activities of daily living, commonly referred to as the ADLs, that an individual cannot accomplish alone. There are 7 standard ADLs. They include personal hygiene and grooming, dressing and undressing, meal preparation, transfer, being able to get out of bed or in tar, things like that, voluntarily controlling elimination, ability for elimination, and ambulation, walking without canes, crutches, wheelchairs, or the ability, typically is gauged by the ability to maneuver stairs. There are varying of care that are needed. There's the very base minimal, which is the homemaker services. That's somebody who can run your errands, perhaps cook a meal or two, and assist you with cleaning around the house so that it remains sanitary. There's home health aides, people who provide a higher level of service. They are nurses, some RVNs or LVNs, people who can help you with your medication, who may be able to do clean linens, do bed change dressings, things of those sort that is beyond what a family member or a friend may be able to do. There's adult daycare, and that's basically somewhere it's for exactly what it sounds like. It's somewhere for somebody who needs monitoring during the day, but they have other options at night. So typically what we see with the adult daycare is a situation where somebody's relying on their family to help them out, but the family must work during the day and they get alone. The assisted living facility, that's a facility where you go and you actually live in an apartment-style kind of place, and services needed provided on an as-need basis. And then, of course, there's the home or the skilled nursing facility. It's important to have a good idea of what the costs for long-term care are. So what we do here on a regular basis is monitor the costs. Genworth is a wonderful financial institution, and they do an annual survey of what costs are for long-term care. You can see what I have here is California, the median care. They have a great website. If you're interested in what that website is, I'd be happy to provide that, or you can Google Genworth long-term care study, and it'll take you to the website where you can look and see what the cost is if you have, if you want somewhere, say back east, North Carolina or Hawaii, if you have, thoughts of moving somewhere. You can see here that, the basic, the home health care is about $20,000 a year, all the way up to nursing care, nursing home or skilled facility, and the cost of a private room is $1,000 change. So when we look at long-term, basically, it's risk, right? It's a risk that you may need it or you may not, just like any of the other things that we choose to insure, losing your home in a fire. About 1 in 1,200 people will lose their home to a fire. You can't see the number there, but the percentage of experiencing a loss of your home to a fire is 0.04%. Having a car accident, this is a major car accident, not just a little fender bender one that you would definitely turn into your auto insurance for. That's about 0.8%. People from the age of 55 to 65 needing long-term care, the probability is about 10%. 1 in 10 people are going to need some kind of long-term care. People ages 65, 80, the probability of needing some sort of long-term care is about 25%. And people over the age of 80 needing long-term care, you have about a 50-50 chance, 1 in 2. So the first question to ask is, are you need long-term care? In order to, kind of get you around that question, we start with your family medical history. For example, my family, we have rheumatoid arthritis run rampant, and I have a number of my family members who have had strokes. So those can both be debilitating, and that is something that gives me concern. And I would definitely think very long and hard about the probability of needing some sort of long-term care. Medical conditions. Do you have any medical conditions? Again, using myself as an example, I try and be very active and very healthy to prevent strokes and stay in good health so that I can mitigate whatever my family conditions might predispose me to. And then, of course, there's your medical history. So those are just some things that can kind of help you your mind around, are you going to be that 1 in 10 people who need it or not, or 1 in 4 people, or should you be lucky enough to make it to 8, the 1 in 2. So you do need long-term care. There's a handful of ways you can handle it. The first is government support through Medicare and Medicaid. You can self-insure, or you have family support. Insurance, long-term care insurance is something that we hear a lot about. The important point to note here is that we talk a lot about insurance. It's not the only way to handle this risk. It's a very popular way for a variety of reasons that we'll get into in a little bit. However, it's important to note you have choices, and that's really what is the focus of this presentation, is to just frame up the discussion, help you through some of the questions you need to, and then decide how you want to handle it. So we'll start with exploring what is government support. So the government support that's available to you, there's a lot of misinformation, misunderstanding about what exactly is available to you in the Medicare. So Medicare does not really cover long-term care needs. It's a very tricky land to navigate, but basically it's national health insurance for people 65 and older and people with certain disabilities. It's extremely limited. In most cases, it doesn't last any longer than 100 days, and in a lot of cases, it won't even last for 100 days. It really depends on the individual circumstance, but the important point to note here is that Medicare is not long-term care insurance, and it is extremely limited. There's also Medicaid, which California is referred to as Medi-Cal, and that's an in-state federal program, and is basically for people who are poor or have very limited resources. It does pay for some types of long-term care, but it's primarily only skilled nursing facilities. We had talked about the varying levels just a moment ago. The home health services or adult daycare does not cover any of those kinds of things. Some of the drawbacks with Medi-Cal are that your choice in facility is extremely limited. And in California, we're an asset-based state, and so in order to be eligible for Medi-Cal to pay for long-term care costs, if you're full and you have assets over $2,000, it's not going to cover it. Or, well, let me just say for a minute, it will not cover it. Well, if your assets are over $103,000, those are round numbers, approximate, and they change every year. They're adjusted. But the point is to just give you an idea of the level of assets that qualify you or disqualify you. Now, what I will say is that if you do need long-term care